We welcome back Lucretia Ryan, financial writer, educator, philanthropist, and founder of financialfreedomforwomen.org. Lucretia also hosted a popular 403b Wise event, Dirty Little Secrets of Medicare Advantage, which we turned into a podcast and which is linked in today's show notes. How are you?
Good, good. Yeah, I'm actually in Florida today. It's a little rainy, which actually the weather in Florida, January to March is gorgeous. So
I bet.
yeah, not to rub it in the people up north, the snow.
Yeah. Well, where Scott and I live is pretty darn good right now, although anything over 70 is too hot for Scott. So
That's right.
I'm telling you, Scott, Sweden, move to Sweden.
Yeah, I went to a polo match yesterday. I'd never been to a
Oh,
polo match.
wow. What was that like?
So, I have my little foo-foo dog with me sitting on my lap watching polo. And, it was exciting. I've never been to a polo match. So I enjoyed it.
That takes such skill. You
Oh,
know, the horse, the rider is a very small ball.
I just think staying on the horse
Yes.
that's a positive.
Yeah. It's a little bit like hockey. Just to play hockey, you have to be able to skate well.
It's true. That's true.
All right. We're going to talk about a topic that is very personal to you, Lucretia, and suddenly very personal to me. And it's nothing to do with my personal health because I've spoken about some of my health challenges I had over the summer, which I'm here to report I am doing fantastic and things are really ticking up on that front. But in a moment, I'll share why the topic of getting health insurance is very germane to me. Okay, Lucretia, why is healthcare and retirement personal for you?
Oh, yeah. Well, if teachers retire before 65, I think most people don't realize, I certainly didn't realize that healthcare insurance is incredibly expensive. And there's a lot of different choices, and you could really make the wrong choice. Um, and there's not a lot of information out there. So I retired early, before 65. So I had to figure out what was my best option for healthcare insurance.
Yes, in this country, I've got to watch myself. We make it unbelievably difficult and unbelievably expensive to get healthcare. So when you may be at your most vulnerable as you're aging and you're not quite at 65, it can be very dicey. So, did you tell us the last podcast the age you retired?
I retired at 60.
60. So you had 5 years. I will be 60
Yeah.
in May, and I don't think I'll be retiring, although surprises are hitting our family all over the place, Scott. So I guess you never know. But I would hope to work a little longer than 60. But I assume there's a world where I assumed, I'll put that past tense, a world where I would need to get health insurance. Anyway, a little foreshadowing. Okay, so what we're going to do today is we're going to go over all the different options as it stands in 2025. And we're recording this in February 2025. Topic is how to get health insurance prior to age 65. So, Lucretia, the first option and the best option is spousal coverage. It's kind of self explanatory in the title, but you want to elaborate on this?
Yeah, what people don't realize is so you can either get insurance through your spouse, or some companies offer a domestic partner health care. So that health care the employers offer to their employees is typically the best health care you can get before 65. It's a benefit. They use that to attract employees. So that is subsidized, and it's available to your spouse, or sometimes domestic partner. So if you have that option, that would be my first choice, is to go on the health care that your spouse, if they're still employed, is working. That would definitely be the best.
Yeah, start with that. And I will tell you, Lucretia and Scott, until last week, I thought I myself had health care through my spouse's company. And as I shared before we started, we found out that my wife's employer stopped paying healthcare premiums on December 1st. And we found this out a week ago. So this was quite the surprise to our family. Her company is having all kinds of issues. So I'm going to say right now, if you need a fantastic web designer with amazing UX, UI design and strategy skills, hit me up at hello at 403bwise.org because you would be very lucky to employ my wife. Okay, some kind of dysfunction is going on at my wife's company. And so we have had to scramble to get health insurance. So I think my experience, I think will add to what we're trying to do today as we go through these options. But I can tell you right now, it's a little frightening being the age I'm at and suddenly not having health insurance. So we spent a weekend looking at our options, and many of these you're going to go over. But I just want to put that out there as something that is affecting me today. Hopefully, it won't continue to affect me, but that is where things stand. Okay, Lucretia, after spousal coverage, what
So
is your next? Oh,
yeah,
go
so
ahead.
then the next best option is called Cobra. So essentially, if you leave your employer, you retire, you're laid off, um, you can buy insurance, the same insurance that you had from your employer at the price that your employer pays for it. But your employer no longer subsidizes it. So, but the gotcha that you have to watch out that I was not aware of is it's the exact same choice. So for me, I had a Cadillac plan. I had the best, I paid for the best um, healthcare plan from my employer. Um, that was available because it was very reasonable because it was subsidized. So then when I left and I took Cobra, which is available for up to 18 months, it was that exact Cadillac plan. So if I were to do it over again and know that I was going to retire in a year, I would probably pick a cheaper plan so that my Cobra would be cheaper. So my Cobra payments were about $600 a month. So that is your best option, and it's the exact same plan that you got from your employer.
And how long does that last? Is it
18,
18
18
months?
months,
Yeah,
up to 18 months.
I'm seeing it can be no more than 102% of the cost of the plan. So it could actually be a smidge higher than the full amount you were paying. That's a really good piece of advice to make sure you're in the plan that you're going to want to be when you actually do retire. All right, pop quiz for you two. What does Cobra stand for?
Consolidated Omnibus Budget Reconciliation Act? Is that it?
Mr.
Not even to
Downhauer.
try. I'm not even going to try.
I don't know if I could have gotten one of those words. Maybe act. I probably could have gotten act. Very impressive, Scott. That is the title of it.
I didn't look it up, I promise.
I was
But I don't know what
cramping
I had for
saying
breakfast
that.
this morning, Dan.
Healthcare in this country feels like you were being attacked by a cobra. Maybe that's why a venomous cobra. Maybe that's why they went with that acronym. Sigh. Okay. And then, so excellent story there, Lucretia.
And
Now,
I just want to point out that I know some school districts allow you to, so in Connecticut, you could buy um, your health plan for until you're 65. So in Connecticut, the cost is like $600. Because they subsidize it like $200 or $300.
per
So
month, right?
yeah,
Per
so
month.
for teachers, they may not have to go to their spousals. They may just their school district may offer um, a health plan that they could buy. It's expensive. And I have another friend who does it in New York State. And that is very good insurance as well.
Yeah,
And what are we talking about? The ACA. So these plans that you get from your employer are also governed by the Affordable Care Act. So you don't have to worry about them being non-ACA compliant plans.
yeah. Thanks for bringing that up. I was gonna mention that a lot of education employees have retiree health care. But I think it's really important that you read your collective bargaining agreement as to exactly what that looks like. Because sometimes you have to have a certain number of years of service, at least in order to get a subsidy. Sometimes there cannot be a break in. So, for example, if you are retiring from the district, but not retiring from the retirement system, you may not get it. So there are different requirements, and it varies across every single school district. So check that out. But like, for example, my wife's school district, she's worked enough years. Well, she would get 5 years of subsidized retiree health care, and it would, it wouldn't cover the entire cost, but she would get up to 5 years. And then after that, if it's still prior to 65, she could stay on. But it's only if she retires from the California State Teachers Retirement System at the same time, which we don't plan on doing. So it's probably going to be ACA for us. So with that transition, let's talk
If
about
it's still around, Mr. Downhauer.
with thanks, Dan. So see if we can make this a little more upbeat. The Affordable Care Act has really been a lifeline for a lot of people. I have a child that's on it. Dan is now on it. Lucretia, I believe you are on it, or have people that you know that are on it. So let's talk about the Affordable Care Act. Some people don't know what the Affordable Care Act is because it's often referred to as Obamacare. I like to refer to it as the Affordable Care Act so as to not make it a political uh, statement, and often people are more open to using it. If you just call it by its real name, the Affordable Care Act. So let's talk about it. Lucretia, how does the Affordable Care Act work?
Yeah, so it was started in 2010, and when it was first came out, everyone had to have insurance. Well, that was changed, so not everyone has to have insurance. So the way it would work is around, I guess, October, November, December, around that time frame, you could sign up for the following year. You go to healthcare.gov, and if your state has its own marketplace, it'll direct you to it. So like Connecticut has Access Connecticut, and you go there and you put in what your age and some other information, and then it'll show you what your different choices are. And there's three basic categories: is bronze, silver, and gold. And you and it you know there's more different copays, and there's different deductibles depending on sort of the range. And then within, say, the silver category, uh, you see the prices for all of the different different category, the different companies in there, whether it's Aetna, Cigna, whatever, it's a listing of all the different, and then you could drill down and see exactly what that insurance offers. What are the copays? Do you need it? Do you need to see a doctor to get referrals? A lot of all these different, and it's rather complicated to figure out which is best for you, but that's kind of it in a nutshell. And then January 1 of the following year, you start paying your, the payments that you have to pay towards that, and then you're covered for the year. And pre-existing conditions are covered. And as long as you keep paying, you won't be dropped. There's a lot of guardrails in the ACA compliant healthcare insurance.
And so, what are the pros and cons of the Affordable Care Act?
Well, yeah, so for that type of insurance, the big deal is, you have pre-existing conditions. You also know exactly what's covered. So like you won't be surprised. Oh, they don't cover you know, uh they don't cover wellness. They all cover the same things if if you buy it from healthcare.gov from the marketplace, they all cover the same things. And they definitely cover preventative type care. They cover pre-existing conditions. And it's very well regulated. You don't have to like try to look through a 2-inch contract to find out, what procedures they cover. They may not, they all cover the exact same thing. I think that's kind of the biggest thing. It is still complicated, but at least they have to follow federal and state regulations.
One of the things that I think is, I mean, really just incredible about it, and what I think many people might miss is what you just said, the pre-existing conditions. Uh, the ability to, so like if my wife ever, I'm on my wife's healthcare. My wife's an educator. If she ever stopped teaching prior to 65, she has a chronic illness that costs a lot of money. And it's a pre-existing condition. Prior to the ACA, if that chronic illness prevented her from working, we would not have access to health insurance. We would probably be put into this thing called like a high risk pool, something that you're gonna start hearing about again very soon. And that is a very bad idea. Um, it's a last ditch option, which is kind of what's going on here in California for fire insurance. But I can't tell you I guess it helps lower anxiety and stress when you know that worst case scenario, there's going to be a plan available to you that's going to cover your health conditions, regardless of if you can work or not. And I think that is one of the beauties of the ACA. It's not perfect. There are many things we could improve with it, but the pre-existing conditions, I think it's just an amazing part, and part of what was revolutionary about it.
And let's contrast this to non-ACA compliant insurance policies. So I'll give you an example, a story that was printed in ProPublica. So if you don't buy your insurance from the healthcare.gov or your state's marketplace, you are buying a non-ACA compliant plan. Unless you get it from your employer. But if you go to an insurance company, if you work with an insurance agent, it will be non-ACA compliant, which means they don't have to cover pre-existing conditions. So ProPublica published a story about a young man who he got this, often referred to as junk insurance. The insurance seller will never call it that, but that's what it is. It was much cheaper than what he could have gotten on the ACA. And, he thought he was covered. He was young, he was healthy. He thought he was fine. But he had a little back pain. He had gone to the chiropractor before, but other than that, he was a landscaper, so that was no big deal. So then he had more pain, and he went to the doctor, found out that he had a tumor on his spine. And so it was cancer. I think it was Hodgkin's lymphoma. And he had extensive treatment. His bill was $800,000,
Wow.
which is not unheard of for cancer. Right. I mean, they really will, the bills will be up there. So his insurance company, which was not ACA compliant, said, does not cover pre-existing conditions, and said, well, he went to the chiropractor before he got the insurance for back pain, so he must have had that tumor on his spine, so we're not covering that $800,000. So,
Wow.
so, not only might not they not give you it, they're going to look for every excuse to say that this was pre-existing, conditions.
That was United Healthcare, wasn't it?
Yeah,
They have
yeah.
a job opening, I heard.
Oh gosh, Dan. Um, so So another reason why you should be very careful about the type of coverage that you choose. I think we're going to talk a little bit more about non-ACA compliance because there's also these cost sharing and religious organization healthcare plans as well, which I don't love. I think I they're not really insurance companies, but we'll get to that. So another really revolutionary part of the ACA is how it is structured in terms of how much it costs for people and the types of subsidies that are available. Can you talk a little bit about the subsidies and who qualifies for them?
Yeah, so the way that the ACA was set up is you put in what you think your income will be for the year. And so I'll give you an example of a 35-year-old male who was going to make $30,000. So uh, for silver, it would have been like around $500 a month, but he got a subsidy of $350 a month. So he only had to pay $150 a month. And then when he does his taxes at the end of the year, it's a true up, and you say, well, this was my actual salary when you do your taxes, and you either get a credit or you have to pay more. So they subsidize it for low income, and it's based on your family size and um, what your income is. And did you want to add to how it works like that?
Yeah, yeah. So the larger your family, the lower your income, the bigger the subsidy. Is that correct?
Yeah. And then also, but then another part of the ACA, the way that it was crafted was, well, if you have below a certain level
Oh, right.
of income, then they assume that you will be eligible for Medicaid. So if you live in the state of Connecticut, um, you know, let's take that same man. So he was 35, he was getting the subsidy, lost his job. If he was in the state of Connecticut, well, now he would go on to Medicaid, which would which is I don't know if it's what low cost or no cost, it's very low cost. And he would get health insurance. However, in about 10 states where they don't allow childless adults to go on Medicaid, so if that same man lived in Florida, and he lost his job, his low paying job, and now didn't have an income, he would lose his subsidy and he wouldn't be eligible for Medicaid. So he would have to pay that $500 a month, even though he has no income. So in about 10 states, and I'll tell you what the states are, um, they have this hole where if you're below a certain thing, you can't get, and you can't get Medicaid, you get no subsidy. You can't get health insurance. So it's Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, Wyoming. So, you have to be careful in those states that you don't make less because then you lose your subsidy.
Oh my gosh. It's this is part of why people get so frustrated with healthcare. It's not even similar across states. There's probably something in common with those 10 states. We'll let our listeners figure that out. The other thing that I think a lot of people don't realize, and I didn't actually realize this, is individual states can also enhance those subsidies. So in some states, based on income, the copays and deductibles and cost sharing can be absorbed by the state. So like in California, I think it was this year, if you're at a certain income level, there are no copays, there are no deductibles for people who are under a certain income level, which again makes healthcare way more affordable for those people. Those are like generally like year to year. They're not, they're not like ob often permanent. So that's, I think, a really interesting thing. And then the Inflation Reduction Act added in a sort of a new subsidy. Actually, that's yeah. Let's talk about that. But it expires at the end of 2025. Do you want to talk about? Do we want to talk about the cap on ACA subsidies?
Yeah, I mean, I don't know what's going to happen, but why don't you give your best guess?
Well, oh, gosh. So what was really neat about this cap, and it was extended once. So with the Inflation Reduction Act, um, it basically allowed for subsidies to be to so that healthcare would not be any more than 8.5% of your adjusted gross income, regardless of I believe regardless of your income. Don't quote me on that, but that's my understanding. Um, that was that was to be short term. I think it was like 21, 22, something along those lines. And then it was extended for 23, 24, 25. But it expires at the end of 2025. And that is going to lead to some massive increases in people's premiums if these subsidies aren't uh, basically renewed or made permanent. So, there's a lot of talk of getting these renewed. However, uh, you know, there's there's not the politicians who want that renewed do not hold the power in Congress right now. So it's really going to be interesting to see how that plays out. But it is, I think, leverage that can be used in negotiating all sorts of things that one side wants. So if I had to guess, I'd say that goes away. However, um, this is a country that just went through an election that largely based on inflation made a decision. And if suddenly prices are continuing to go up and then in 2026 healthcare premiums jump by another 20, 30, 40, and in some cases it's going to be 100% or more jump. I don't know. That seems to be a bad thing to do in terms of this inflation. So I don't know. What are your? I think it's not going to be renewed, but I hope to God that I'm wrong.
I have no clue, but I don't think people realize how much the ACA protects them. So,
Yeah.
as I said, when I was going through I didn't know either. So when I was going through, I looked at my options, and my friend told me, "Oh, here's a great insurance agent. She has some great policies for you, and they don't cover things that you don't need anymore. So I think that this, why pay for things that you don't need? Uh, you know, that type of thing. So I spoke to her, I met with her. I was like, eh. I'm a doubting Thomas. I don't really, I like it. I like things that are regulated by the federal government, and everything has to follow the federal government rules. So these do not. So my friend, signed up for it. So through the ACA, my cost would have been about $1,000, and this was going to be like $600. So, I didn't take it, but she took it. And so then she had heart trouble, probably a panic attack, I don't know. But she went to the emergency room. They did all these tests and everything. Her bill was $10,000. And the insurance policy covered maybe 1,000 of it. And, you read the little writing um, in the contract, and they'll have caps on, for surgery, $2,500 cap. You have to like go through a thick document to figure out. Whereas if it's on the ACA, they cover the exact same things. They can't have these caps. They can't have all of these hidden things. So, and now the following year she went on the ACA. So, but I think people say, like, I didn't realize how beneficial it is to me personally to get my policy and pay more at the ACA than to have my own free will and sign up for any policy that I want and save money. So people don't realize till it's too late and they have some health,
If
concern.
only there was a federal oversight group, a consumer like protection agency that could look into this kind of stuff, to make sure that everything's on the up and up.
Oh, Dan. So
Truth, just dropping truth bombs.
I don't disagree. I think I think you're right. And when people start losing these things, it's going to hit them really hard. And like healthcare is just so important, and you don't realize, like you just said, you don't realize how important it is until you need it and it's not there. Um, so I want to touch on this one more time with these premiums, potentially, let's see, these enhanced premium subsidies, the 8.5% cap potentially expiring. The Kaiser Family Foundation, which is a nonprofit organization that does research on health policy, they estimate that if a couple making $82,000, if these caps are eliminated, that their health insurance would double in 2026. So I think there's a lot of people who are in for some big surprises come 2026 if we don't do something. And the other thing I just want to say is if you're an educator and you're considering and you're looking at retirement, you're planning retirement, I see one of the things that I see the most is that they're not planning for retiree healthcare prior to Medicare. And there needs to be a lot of effort put into, you need to know exactly how, and this is the point of this podcast. You need to know exactly how you're going to handle that, where it's going to come from, what those costs are going to be, what the premium subsidies are, and what they could be. Because without that knowledge, you could go into retirement and have a major cash flow deficit that you were not expecting.
Yeah, I think people uh, will be shocked when they see the cost. And that sort of brings up another point that you sort of alluded to was to get how to get these subsidies. And so you really need to work with your financial planner or your accountant to figure out your income. And if there's ways to move income to like the year before or to, take your income from the brokerage account so that you're just, you have less income, all these techniques so that maybe you can, defer your pension, maybe you can qualify for these subsidies. So there was a couple that I had spoken to, and before he retired at 63, he was able to cash out some of his mutual funds so that he had the income when he was still working and then live off that income for the next 2 years. So when he was 64 and 65, he really, on his taxes, did not have much income. So he was able to get, those subsidies.
Yeah, there's if you plan and do the work, it really can be a substantial savings. So you really, and there's a lot of resources on the internet on these, and we'll link to some in the show notes. We've already sort of talked about Medicaid, but what is there anything else you want to add about Medicaid? I know that if you had mentioned if you don't make enough money, you will be on Medicaid. I have actually seen people who will literally take distributions from their IRAs in order to make sure that they have enough adjusted gross income to not qualify for Medicaid and qualify for the ACA because that's where their doctors are. Because sometimes their doctor's not available in Medicaid. So, do you have anything you want to add to the Medicaid question?
Well, Medicaid is not as good as the ACA. I mean,
Yeah.
it's not. Um, a lot of doctors won't take Medicaid.
Mhm.
A lot of rehab facilities won't take Medicaid. A lot of places won't take Medicaid. So, it's definitely is not as good as the ACA. Um, but if you can't afford it, but I could see why they definitely would do that. Yeah, that makes a lot of sense.
I would also add, we're recording this on the 24th of February, and there are discussions about severely slashing Medicaid. Doesn't mean it's going to be law, but every proposal I've heard working its way through the House and the Senate could involve major slashes to Medicaid. So that is something to think about. Looking at our list of questions here, there's one form of health insurance we don't have on this list, and that's self-insurance. And that's for extremely wealthy people. I'm a fan of Scott Galloway. He has a podcast called the Prof G Podcast, and he's on Pivot with Kara Swisher, and he self-insures. Do you want to talk about that at all? I know it's out of touch for probably almost if you could afford that, you listen to our podcast, you probably have downloaded the wrong podcast.
I think it's crazy
Yeah,
because um, you know, people get breast cancer who have no signs, the year before, and cancer treatment could be 800, $1 million. So, and you want to go to the best care at that point, like in my mind, what's more important than your health? I want to be, if I'm sick, I want to be able to go to the best doctor, and, it doesn't matter. I don't want to be worrying about the price. So, and I think the outcomes totally are affected by where you go for your health care. So, uh,
agreed.
I would not, that'd be way too risky.
No, I agree. I think you probably have to be worth at least $25 billion to even begin to entertain such a way to go about it. I guess the other thing is, have you heard of health tourism, where Americans live overseas and get
Yeah.
really good health care that's affordable?
Yeah, or they go and have procedures done overseas
Yeah.
that
Yeah,
are too expensive or not covered in the way they want to. Actually, there's a lot of medical tourism here on the Dan and I live in Southern California, so we obviously border Mexico, and I know a lot of people who go to Mexico for their dental work. Um, I'm not saying you should do that, but there are actually some very good doctors right across the border that will do dental work at a cost that's not nearly as high as you'll find here in the U.S. Also, there's probably not the regulation that we have in the U.S. that's there to protect you. With that, on that note, I want to go back to the non-ACA compliant plans, which I think which should also include I know people who are on I don't remember what they're called, but they're not really insurance plans. So
Right.
there's non-ACA compliance insurance plans, and then there are cost sharing programs. Often they're affiliated with a religious group or with an association group. And I have seen many personal finance gurus push these as options for people. I'm not a fan. I don't want to completely exclude it as an option, but these are not real insurance options. They are cost sharing among people options, and I feel like that's kind of dangerous. Do you have any thoughts on that, Lucretia?
Yeah, I had a friend who did one of that, and so she had to agree to believe in Jesus, and uh and then the other thing was she would have to pay out of pocket and then get reimbursed.
Oh, I didn't. That's
Yeah.
okay.
So uh she was okay. She had some minor issues, but health issues, but she was okay. But uh you do have to get reimbursed in a lot of them.
That means you got to have cash on hand, like potentially a lot of cash on hand in order to pay for it and then get
Or, or,
reimbursed.
or you put it on your credit card, which is why
Yeah.
people have such high credit card debt is often medical bills.
I will tell you, when I found out that we didn't have health insurance, I did scream out Jesus, but I use his full name.
H? Did you have the
I
H?
had the H in there.
Oh, Dan, you're
So
great.
just a couple of
All
things
right.
on those non-compliant plans. Guess when they were enacted?
I don't know.
2018. Same year that the requirement to have health insurance was killed. And why
Right.
would you require everyone to have health insurance?
To lower premiums for everybody
To
because
lower
healthy people
premiums.
generally do not get health insurance. Well, may not get health insurance. The reason you want the very healthiest people in the pool is to lower prices
Yeah.
for everybody.
So that happened in 2018. So I think that makes me very skeptical these subsidies will be continued. But
Yes, so there was a loophole that you could have these 3-month um uh temporary policies. And in 2018, they expanded that to 3 years. So these
Mm.
policies were never intended to be long-term policies. So that's why they really, they have all of these holes in it of what they cover because it wasn't so people don't realize that there's all of these holes in them and they could be on the hook for these bills.
oh, I think we're going to be hearing that expression more and more in the coming months and years. Okay, Lucretia. So you had a decision to make, and I'm guessing you didn't self-insure.
No, yeah. So what I was able to do is get health insurance through my employer. So they had a special retiree plan, which was not as good as an employee plan, but it was ACA compliant, and it was through my employer, and it's about 1,100 a month. Um, and then I'll be keeping that and paying that out of pocket until I'm 65, and then I will go on original Medicare with a Medicare Supplement G, and a drug plan, and then I will have fantastic medical coverage. But like some teachers, some school districts offer these retiree plans in the interim. That's what I did. But otherwise, I would have gone with the ACA plan.
Well, I just got my letter from Covered California, which is the administrator of the ACA in California. And starting March 1st, I will have health insurance. I'm going to like wrap myself in bubble wrap until then and just stay in my house so nothing happens to me. And to cover myself, my wife, and our 20-year-old son, we will be paying $1,790 a month. And it mentions here, and this is a Blue Shield Silver plan. I talked before about some heart issues that I had, and for me, it was very important to be able to get access to my doctor. And that was something that was nice while searching for coverage. I was able to easily look to see which of my doctors were, part of various plans. But what it does say in the plan summary is that I am based on my income, I'm getting over $1,000 a month of assistance. So that tells me that if this goes away, we're going to be looking at close to $3,000 a month in health insurance. I think at that point, Scott, I might be looking at some health tourism. I hear Ireland is welcoming Americans, although I have no Irish uh, heritage.
But you drink a lot of their whiskey, right?
I used to. Does that count?
I don't know.
So, okay, Lucretia. So you and I are covered. Hopefully, Scott someday and his wife can be covered. Hopefully, the ACA remains a quality entity into the future. So to summarize, Lucretia, what should someone listening who's considering retiring prior to age 65 be doing now? You gave some great tips. Do you want to sort of reiterate those
Well,
as
yeah,
like
I
a
mean,
plan, action
choices
plan?
in this order, my opinion, is employer or spouse plan, then Cobra, then either an employee retiree plan or the ACA. I I would not buy the other
Yeah.
insurance. I think it's too risky. The reason I have insurance is for catastrophic, and I want to make sure I'm covered.
Yeah.
You know, so many people I know get breast cancer out of the blue, and that's going to be exorbitantly expensive. So, that's pretty much what I would do. And then if I was going to go on the ACA, I would see how could I look at my income so that I would have uh, be eligible for subsidies. Do I take income the year before? Do I take the income from different pools? Do I defer pensions or taking money out of my 401k? You have to work with your financial planner or accountant to figure out what your income will be on those years so that you have money to live on, but maybe you could qualify for those subsidies.
No, that's such good advice. And also it can be difficult to estimate your income. You think it's going to be one thing. In our situation, my wife, it looks like she has lost her job. She has not received a paycheck since December 31st. So we are proceeding as if she does not have a job. And then you could get a job, and then I guess you go back to ACA and you cancel it. There was one strategy I had thought of. My wife didn't like this very much, but I thought it was a good one, but I don't think it would work anymore. And my plan was we know a couple who are Canadian, and we were going to see if they would divorce. I would marry the wife, Mandy would marry the husband. We would then get Canadian health insurance, and then we would divorce, and then Mandy and I would remarry. Would you recommend that, Lucretia, as a
Well,
strategy?
why don't you just divorce and marry an American with health insurance?
I want to be married to my wife.
Uh,
Then we'd
well, you
get
can't have
remarried. That's
everything.
then we'd get Canadian citizenship, and then we'd be remarried. I used to live in Buffalo, pretty close to Canada. Can they just would that count? Is that a way to get health insurance?
I don't think so, but a lot of people get medicine from the Canadian
Yeah,
pharmacies.
yeah. No,
What
I don't think
what would we
Canada's.
call that? Swinger care? Like I don't
I like that swinger care, Scott. Scott, check the URL on that. We need to get the website. Hey, that's what
with an
Mandy.
upside down pineapple as the
This is
mascot.
perfect. Now we've got a job for Mandy. She can run that website, Scott. That is brilliant. I know I tried to kid because this is serious, but it is embarrassing. I think two things about our country that embarrasses me is that we're not on metric system. It's us in Syria that are still using ounces. How many ounces are in a cup? Who remembers?
Nobody knows.
Nobody knows, right? That'd be a great skit. I think the next skit that Nate Bogotsky's going to do
Yeah.
on Tonight Night Live is going to be around health insurance.
That would be a good one. That would
Is
be
it
a good one.
covered? No. Is it out of
Nobody
network?
knows.
Yeah. Sir, if I get shot by the British, are you out of network? Oh, sorry.
All
Okay.
right.
Any
Can
last
we end on a positive
Yeah.
note maybe? Let's find a positive note here.
Yeah. So I wanted to share my nonprofit, Financial Freedom for
Oh yeah.
Women.org. So I started that to help women with financial empowerment and education. So I've really found that it's been rewarding. I write articles, I do podcasts, and I do one-on-one retirement optimization workshops. So I will help teachers look at what their 403B options are, what are the fees, what are maybe better options. And I could look at what their investments are. It's not investment advice, but it's more education. I don't accept any fees from anyone, from any financial institution. I don't sell any products. I don't have any advertising. I don't accept any donations. I fund this solely on, with my own money and my own time. And I have a friend who's a fantastic web designer, Emily Roth, give her a plug there. And people just contact me from my website and I schedule a 1 hour session. We look at what they're invested in their 403B. They're always shocked when I point out that they're invested in annuities. They never know they're invested in annuities. Nowhere on the website does it say that it's an annuity. It says surrender fee and contract, and that's like a red flag. But I find this extremely rewarding. I know I make a difference in a lot of women's lives. I'll just put that out there. You could contact me, financialfreedomforwomen.org. There's a contact me button. You know, strangers contact me every day.
Us,
And
we're an example of strangers.
and I'm always happy to help because this is my superpower and I just want to help people. So I think that is a very positive note to end this really tough topic on.
Yeah, no, we are so proud to know you. We are so impressed with what you do. I love when people are willing to help others. It is what makes our country great. Now, I talked about a couple things I think we can improve on as a country, but whenever I get frustrated, I just talk to my neighbors. I talk to people I meet, and you realize we are generally a nation of pretty darn good people, and we will get through this, I believe. And it's because of people like you, Lucretia. We post a lot of your articles on our weekend wisdom, and they get a healthy click rate.
Yeah. Yeah, this article, I think there was over 200 people who read the article from your Facebook. And then on the Medicare Dirty Little Secrets, I think over 300 people have watched that webinar. So
And we will put this on our YouTube page, which I've been a little tardy on getting content on, but this is definitely one we will get up on our YouTube channel. All right, Lucretia, I'm going to say not only goodbye, but good health.
all right, thank you. You too, guys. Bye-bye.
Thank you for all you do.